Take a good look at your medicine cabinet right now. If you are over 60, there is a very good chance you will find at least one blood pressure pill sitting on that shelf, maybe two, maybe three. And if you measured your pressure this morning, the number was probably still higher than your doctor wanted it to be. So you took the pill anyway. Same as yesterday, same as last year, same as you will tomorrow. I want to tell you something the Centers for Disease Control quietly published in their own data, and that almost nobody who needs to hear it actually does. Roughly 120 million American adults have high blood pressure. More than 3 out of 4 of them do not have it under control, even with prescriptions. And among older adults already taking 2 or 3 medications, a substantial portion still walk around with readings well above 140 over 90. The pills are not fixing the cause. They are managing the symptom while the cause continues to deepen underneath. Now, I am going to tell you something stranger. There is a specific edible seed, one you can buy at any grocery store for less than the cost of a single copay, that contains the exact mineral your arteries have been starving for since you turned 50. In clinical research, this mineral, supplied at the dose this seed delivers, has been shown to bring blood pressure down meaningfully, with the response beginning within the first 72 hours in people who were deficient. No prescription, no dry cough, no dizzy spell when you stand up too fast, no sexual side effects, no swollen ankles by evening. The seed is the raw pumpkin seed. The mineral is magnesium. And by the end of this video, you will understand exactly why the pills you have been taking cannot do what 30 grams of this seed can do, what to eat for the next 72 hours to test it on yourself, and the warning signs that mean stop watching this video and call a doctor today. If you want the truth about your blood pressure, the kind of truth that does not generate a billing code, hit subscribe and hit like. That is how this channel survives. Let me describe a Tuesday morning for somebody over 60 inches this country. You wake up with the dull headache that has become so familiar you barely register it. You walk into the kitchen with the slight unsteadiness that started 2 years ago when your doctor doubled the dosage of one of your pills. You take them with a glass of water. The water tastes a little metallic now. Your ankles are puffy, your fingers feel thick when you try to get the cap off the bottle. You sit down, you wait for the dizziness to pass. You think to yourself, this is just what 65 feels like. This is just what 70 feels like. This is just what aging is. It is not. What you are feeling is not aging. What you are feeling is the side effect profile of a treatment plan that targets the symptom without ever touching the cause. The fatigue, the swollen ankles, the metallic taste, the unsteady morning, those are the prices you pay for chemically forcing a vascular system to do what it should be doing on its own. And it should be doing it on its own. The reason it is not, in the overwhelming majority of cases, is something nobody at the appointment is going to say out loud. I want to demolish a sentence you have heard many times. Blood pressure rises naturally with age. This sentence is treated like a law of physics. It is not. It is a statement about industrial populations, not about humans in general. There are populations on this planet whose blood pressure does not rise with age at all. The Yanomami of the Amazon, the Kuna of Panama, traditional Tsimane communities in Bolivia. Their average blood pressure at 70 is the same as their average blood pressure at 20. They have no hypertensive medication. They have something far more important. They have a daily intake of potassium and magnesium that is roughly 4 to 5 times higher than the average American intake, and a sodium intake that is roughly 1/10 of ours. That is not a coincidence. That is the mechanism. When the National Health and Nutrition Examination Survey looked at the diet patterns of older Americans, the data showed that more than 2 out of 3 adults over 60 are not getting the recommended daily intake of magnesium. Not slightly under, substantially under. Decades of substantially under. And every year of substantial undersupply, your arteries get a little stiffer, a little less responsive, a little more dependent on the next pill to do what magnesium used to do for free. Let me walk you through what is actually happening inside your arteries. You can think of every artery in your body as a flexible muscular tube. The muscle in question is called vascular smooth muscle. It is wrapped around the artery in a continuous spiral, and its job is to contract and relax thousands of times a day so blood pressure stays in a healthy range as you stand, sit, eat, sleep, climb stairs, get scared, get angry, fall in love, anything. Two minerals control that contract-relax cycle. They sit on opposite ends of a seesaw. Calcium tells the muscle to contract. Magnesium tells the muscle to relax. When the seesaw is balanced, the artery flexes and releases like a healthy young rubber band. When magnesium runs low, calcium dominates the inside of the muscle cell, the spiral tightens, and the artery stays in a partially contracted state every minute of every hour. That is exactly the mechanical situation we call hypertension. Now think about what your blood pressure pills do. Calcium channel blockers force calcium out of the muscle. ACE inhibitors block a hormone that signals contraction. Beta blockers slow the heart. Diuretics reduce blood volume. Every one of those drug classes is doing the work magnesium would do for free if your tissues were not depleted of it. Pumpkin seeds contain 3 things at once that the depleted artery needs. First, magnesium, approximately 150 milligrams per ounce, which is one of the densest food sources on Earth. Second, potassium, which counteracts sodium and helps the kidneys release excess fluid. Third, L-arginine, an amino acid the inner lining of your arteries converts into nitric oxide. Nitric oxide is the molecule that signals smooth muscle to relax. It is the same chemical that nitroglycerin tablets release for patients with chest pain. Pumpkin seeds give you the raw material to make it yourself, around the clock, for less than $1 a day. Before we go any further, I need to be specific about something. If your blood pressure is reading 180 over 120 or higher, you are not in the territory of seeds and lifestyle. That is a hypertensive emergency, and it requires immediate medical evaluation, often in an emergency room. If you are experiencing crushing chest pain, sudden shortness of breath, sudden severe headache unlike any you have had before, vision changes, slurred speech, or weakness on one side of your body, stop watching this video and call 911. None of what I am about to describe replaces emergency care. If you are taking warfarin, a potassium-sparing diuretic, such as spironolactone, or a medication for chronic kidney disease, do not significantly increase your potassium intake without a conversation with whoever manages your prescriptions. Pumpkin seeds are food, not medicine, but in those specific situations, the math has to be done with your clinician, not by yourself. Picture a man, I will call him Frank, 7 years old, retired electrician from Ohio. Frank came into a primary care visit on 3 blood pressure medications. His morning reading at the office that day was 158 over 96. He had been on these 3 drugs for 11 years. He was tired all the time. His ankles were so swollen by evening he could not get his work boots back on. He had stopped having any meaningful intimate life with his wife 2 years earlier because of the medication side effects. He was convinced he needed a 4th pill. Frank's labs looked clean. Kidney function fine. Thyroid fine. cholesterol on the higher side, but not catastrophic. The clinician asked him a question that nobody had ever asked him before in 11 years of treatment. How often, Frank, do you eat seeds, nuts, or dark leafy greens? Frank thought about it. Almost never, he said. Bread, pasta, occasional sausage, plenty of coffee. Greens were what showed up next to the meatloaf at restaurants, and he pushed them to the side. Standard blood serum magnesium came back at 1.7, which would be reported as inside the normal range. But serum magnesium is a poor reflection of tissue magnesium. The body protects the blood level fiercely while the cells go empty. A red blood cell magnesium test, which is more sensitive, came back at the bottom of the deficient range. Frank started 30 grams of raw green pumpkin seeds a day, split into 2 portions, with 1 cup of cooked spinach added to dinner. 72 hours later, his home blood pressure was 142 over 88. 2 weeks later, it was 132 over 82. 6 weeks later, working closely with his cardiologist, he was off 2 of his 3 medications, and his ankles were no longer swollen by evening. Frank is not a special case. Frank is the rule once the underlying mechanism gets addressed. Now, I want to give you the exact protocol Frank followed in enough detail that you cannot get it wrong. The seed itself matters. You want raw, green-hulled pumpkin seeds, sometimes labeled pepitas, not roasted, not salted, not honey-coated. Roasting at typical commercial temperatures destroys roughly a third of the magnesium content and oxidizes the delicate fats inside the seed, turning what should be a medicine into something closer to a snack chip. Salted versions add back the very mineral you are trying to dial down. Read the bag. The ingredients should say one thing: pumpkin seeds, nothing else. The dose is 30 grams per day, which is approximately a generous handful, or about a quarter cup. That single dose delivers around 150 milligrams of magnesium, more than 200 milligrams of potassium, and a meaningful dose of L-arginine. Do not take all 30 grams in one sitting. The intestinal absorption of magnesium is capped per meal, and a single large dose is partially excreted unused. Split the daily amount in 2, 15 grams in the morning, 15 grams in the afternoon. Eat them with food, not on an empty stomach, because the high fiber content can cause loose stools in some people if taken without a meal. A small additional step makes a measurable difference. The night before, place your day's portion in a small bowl, cover with water, and leave them on the counter overnight. Drain in the morning. Soaking reduces the phytic acid content of the seed, which is a natural compound that binds to minerals and prevents some of the magnesium from being absorbed. After an overnight soak, the bioavailable magnesium increases meaningfully. The seeds will be slightly softer, slightly easier to chew, and they will taste a little sweeter. Pair the seeds with 2 more deliberate choices. First, add 1 cup of cooked spinach, kale, or Swiss chard to your dinner, or half an avocado to your lunch. Cooked greens deliver another 150 milligrams of magnesium and a substantial dose of potassium. Avocado delivers more potassium per serving than a banana, with healthier fats. Second, do not focus on eliminating salt. Focus on increasing potassium. The ratio between the two is what matters to your blood vessels, not the absolute number on either side. Skip the bouillon cubes, the soy sauce, the deli meat hiding in your sandwich, and let everything else stay roughly normal. Drink water, 2 liters across the day, sipped, not gulped. Hydration matters because smooth muscle responds badly to dehydration. A dehydrated artery contracts harder. Here is the timing across one day. Morning, with breakfast, 15 grams of soaked seeds alongside an egg, plain yogurt, or a piece of whole fruit. Lunch, Include either half an avocado or a serving of cooked greens. Afternoon, around 3 or 4 o'clock, the second 15 grams of seeds with a piece of fruit or another small protein. Evening, a normal balanced dinner, light on processed sodium with greens included. Hydration spread across the day, not loaded into the last 2 hours. Take your blood pressure before you start. Use a home cuff that fits your upper arm correctly. Sit for 5 minutes before measuring. Take 3 readings 2 minutes apart. Average them. Write the number down on a piece of paper, the date next to it. Then start the protocol. Measure again 24 hours later, 48 hours later, and 72 hours later at the same time of day each time. The reason this works in days rather than months is that you are not doing anything strange to your body. You are restoring a substance that should already be there. When magnesium reaches the smooth muscle cell, it does not need to undergo a slow remodeling process. It begins functioning immediately. The calcium channels close. The muscle releases. The arterial wall expands its inner diameter. Pressure drops, mathematically and mechanically, the same week the magnesium arrives. Pills work too, but they work by chemically blocking. They do not refill the deficit underneath, which is why the moment you stop taking them, the pressure rebounds. Magnesium is different. You fill the deficit, then you maintain. Then your arteries do their own work, the way they did when you were 30. 5 things to do tonight before you go to bed. Number 1, tomorrow morning on the way to your errands, stop at any grocery store and buy a bag of raw, unsalted green pumpkin seeds. Look at the ingredients. The label should read pumpkin seeds, full stop. Number 2, measure 30 grams. If you do not have a kitchen scale, a slightly heaped quarter-cup measuring cup is close enough. Split that into 2 small portions. Number 3, the night before each day, put both portions into a small bowl with water. Cover the counter. Drain in the morning. Number 4, add half an avocado at lunch or 1 cup of cooked greens at dinner. One of the two, every single day for the next 3 days minimum. Number 5, take your blood pressure before you start. Take it again at 72 hours. Write both numbers on a piece of paper on your refrigerator where you will see them every day. If your reading drops by 5 points or more in 72 hours, you have just learned something important about your own physiology. The cause of your hypertension was at least partly mineral depletion, not just plumbing. Bring those numbers to your next appointment. Show your clinician. Have a conversation about what your medication regimen looks like in light of new data. If the number does not drop, that is information too. Your hypertension may be driven by something else. Undiagnosed sleep apnea, a kidney issue, hormonal changes, chronic stress. Each of those has its own mechanism, and we will cover them in upcoming videos. Before you close this video, I want to ask you 2 things. First, write your age in the comments. I want to know who is in this audience. Are you 62? Are you 78? Tell me. Second, tell me where you are watching from, what country, what state. I want to see how this audience is spread across the world. You may have just handed them a way out of a treatment loop nobody told them was optional. Your blood pressure is not a verdict. It is not a permanent feature of your body that you have to medicate forever. It is a number that reflects what is happening inside your arteries today, this hour, this minute. And what is happening inside your arteries can begin to change in 72 hours when you give the smooth muscle the mineral it has been waiting decades to receive, a handful of raw green pumpkin seeds soaked overnight. Split in 2, with greens, with water, for 3 days. Measure before, Measure after. Let the number tell you the truth. Subscribe and hit like button. Leave your age and your location in the comments, and I will see you in the next video.